Welcome to the Refusion Podcast, where we transform patient care.
Welcome back to another episode of the Refusion Podcast. I am John, and I am here again with Jennifer. Today, we're diving into a topic that directly impacts patient growth: how a doctor's online reputation influences patient selection, often before a phone call is made or a website is even visited.
That's right. Patients today don't just rely on referrals. They research, compare, and evaluate providers online. Reviews, ratings, and digital presence now play a critical role in determining which doctor a patient ultimately chooses.
Healthcare decisions are deeply personal, and patients want reassurance before trusting a provider. Online reputation acts as that reassurance, offering real-world validation from other patients who've already experienced the care firsthand.
Exactly. According to patient behavior data, the majority of patients read reviews before choosing a doctor. This means your online reputation is often the first impression and sometimes the deciding factor, long before clinical expertise comes into play.
The data is clear. A significant percentage of patients actively read reviews when researching doctors. Many won't even consider a provider who has limited reviews, outdated feedback, or a low average rating.
And it's not just about reading one or two reviews. Patients often scan multiple platforms to validate consistency. If they see repeated complaints or no engagement from the provider, trust erodes quickly, even if the care itself is excellent.
Patients typically follow a predictable journey. They start with online search, review ratings, read recent feedback, and then evaluate how the provider responds, if they respond at all. Each step either builds confidence or introduces doubt.
What's interesting is that patients don't expect perfection. They expect transparency and effort. Seeing thoughtful responses to reviews reassures patients that concerns are addressed and that the provider values communication.
One of the most important insights here is that perception shapes reality in digital healthcare decisions. A provider may deliver excellent care, but if online perception doesn't reflect that, patient acquisition suffers.
Patients don't have access to clinical outcomes data, but they do have access to reviews. That's why perception, formed through digital feedback, becomes the proxy patients use to judge quality, trustworthiness, and bedside manner.
Positive reviews create confidence and reduce uncertainty. They act as social proof, signaling that others have trusted this provider and had good experiences. This reassurance is especially important for first-time or anxious patients.
On the flip side, unmanaged negative reviews or silence from providers can discourage visits entirely. Patients may interpret a lack of response as indifference, even when the issue behind the review was isolated or resolved offline.
Not all review platforms carry equal weight. Google remains the most influential due to visibility in search results and maps. Facebook, Yelp, Healthgrades, Vitals, and WebMD also play significant roles in patient research.
Patients often cross-check across these platforms. Consistency builds trust, while conflicting information raises concerns. This makes it essential for providers to maintain an accurate, engaged presence wherever patients are searching.
Patients don't just read reviews, they read responses. A provider's reply shows empathy, accountability, and professionalism. It gives patients insight into how concerns are handled, which strongly influences whether they feel safe choosing that provider.
A calm, respectful response often matters more than the review itself. Patients are reassured when they see providers listening and engaging, especially when addressing criticism thoughtfully and without defensiveness.
There's a direct relationship between reputation and conversion. Providers with strong ratings, recent reviews, and consistent engagement see higher appointment requests, stronger call volumes, and better patient acquisition overall.
Meanwhile, practices that ignore reviews often struggle with visibility and trust. Even a small improvement in review volume or average rating can significantly influence whether a patient clicks call or keeps scrolling.
Patients also care about recent reviews. A high rating from 3 years ago doesn't inspire the same confidence as consistent, fresh feedback. Fresh reviews signal an active, thriving practice.
That's why ongoing review generation is so important. A steady flow of feedback reassures patients that the experience they're reading about reflects what they can expect today, not years ago.
Manually monitoring multiple platforms can be overwhelming, especially for busy practices. Without a system, reviews get missed, responses are delayed, and opportunities to build trust quietly slip away.
That's where structured reputation management becomes essential. A centralized approach ensures visibility, consistency, and timely responses, allowing providers to focus on care while still protecting their online presence.
RepuGen brings all patient reviews into one dashboard, allowing providers to monitor feedback, respond efficiently, and track trends across platforms like Google, Healthgrades, Facebook, Yelp, and more.
It also helps practices generate new reviews ethically, respond consistently, and identify patient sentiment patterns, turning reputation management into a growth strategy rather than a reactive task.
When reviews aren't managed, patients may assume the worst. Data shows that unmanaged reputation can prevent patients from even considering a provider, regardless of credentials or experience.
In fact, patients often eliminate providers from their shortlist solely based on online perception. Silence, outdated profiles, or unresolved feedback can quietly reduce patient acquisition without practices realizing why.
The path forward is clear. Healthcare providers must treat online reputation as an extension of patient care, actively monitored, thoughtfully managed, and continuously improved through feedback and engagement.
When done right, reputation management builds trust, strengthens relationships, and guides patients toward confident decisions. It ensures excellent care is accurately reflected online where patients are already looking.
Your online reputation isn't just about reviews. It's about perception, trust, and patient choice. In today's healthcare landscape, managing that reputation is no longer optional. It's fundamental to sustainable growth.
Providers who stay visible, responsive, and engaged consistently outperform those who don't. With the right tools and strategy, your digital presence can become one of your strongest assets in attracting and retaining patients.
Thanks for listening to the RepuGen podcast. To learn how to take control of your online reputation, visit repugen.com or connect with our team for a personalized walkthrough.
Until next time, keep building trust, one patient experience and one review at a time.
Thanks for listening to the RepuGen podcast, your path to better healthcare.